You're halfway through a red-eye. The cabin hums, lights dimmed low, and then a sudden soft thump. Someone slumps in the next row. You smell coffee. The person's hand is loose on the armrest, and a few passengers around you freeze and whisper. Your heart rushes, your palms sweat, and you realize you might be the nearest person who can act. Start by slowing your breathing for 10 seconds so you can think clearly. The very first thing to do before touching anyone is a quick visual and verbal check.
If your flight happens to be canceled or delayed, Compensair will help you get compensation for the inconvenience and get your money back without wasting time on red tape. Get a refund for your canceled flight right.
Shout loudly but calmly, "Sir, ma'am, are you okay?" and tap the person's shoulder. If there's any response, keep them still, supported, and call the flight attendant. If there's no response, call for help out loud. "Medic, passenger unconscious," and push the call button if you can. Point at the nearest crew member and keep talking so someone knows there's an emergency. At home, before you fly, prepare mentally and practically. Carry a small basic first aid card in your wallet that lists allergies, chronic conditions, and emergency contacts. Know whether your credit card or travel insurance covers emergency care, and refresh simple first aid and CPR basics online or through a short course. On the day of travel, take your medications, hydrate, and avoid heavy alcohol or sedating drugs before boarding. Many fainting or collapse events are dehydration or medication related. When you're on board and the event happens, use this step-by-step check. 1. Responsiveness. Call and tap. If they respond, ask what's wrong and whether they can swallow or move. Keep them seated and comfortable and summons the crew. 2. Airway and breathing. If they are unresponsive, open the airway with a head tilt, chin lift, unless you suspect a neck injury. Look, listen, and feel for breathing for no more than 10 seconds. If they are breathing, keep the airway open and place them in the recovery position if it's safe to move them. 3. Pulse and circulation. If they are not breathing normally, check for a pulse at the carotid, side of the neck, for up to 10 seconds. If no pulse, start chest compressions immediately and shout for the AED and for medically trained help. 4. Call the crew. Every step should be accompanied by clear, specific requests to the flight attendants. Unresponsive adult, not breathing, start CPR. Or, please bring the onboard medical kit and AED now. Flight attendants will have protocols and a medical kit. They can also request a physician on board. 5. Use available resources. The aircraft's onboard emergency medical kit and AED are legally required on many commercial flights. If a doctor or nurse is on board, the crew will coordinate. If oxygen is indicated and available, the crew will administer it. Why these rules exist is simple. An aircraft cabin is a small, shared environment with limited tools and delayed access to full medical care. Think of it like a small-town clinic. The crew are trained first responders with a compact kit, not a hospital. In the same way you wouldn't expect a mechanic to perform major surgery, airline crews stabilize and coordinate a quicker transfer to full care. Acting quickly and correctly increases the person's odds of a good outcome and reduces the chance of a diversion. Here's the practical risk picture so you can weigh choices calmly. Most fainting or syncope events are benign and related to dehydration or a momentary drop in blood pressure. Those often resolve with fluids and time. But serious causes, heart attack, stroke, severe allergic reaction, do happen. If a passenger needs an emergency landing or diversion, the cost to the airline for a diversion commonly runs from tens of thousands to well over $100,000, depending on distance and logistics. For the passenger, local emergency care and ambulance costs can range from a few hundred to many thousands of dollars, and an ER visit without admitted care often still runs into the low thousands in many countries. Missed connections or travel disruption can add hundreds to thousands more. The worst-case human cost is permanent injury or death if circulation and breathing aren't restored quickly. The cheapest, safest, most practical actions you can take as a fellow passenger are these. Be decisive, be calm, and do the simplest, effective measures. If someone is dizzy but conscious, have them sit, loosen tight clothing, give sips of water if they're awake and alert, and raise their feet slightly if you can. If someone is unresponsive but breathing, maintain the airway, place in recovery position, monitor breathing, and get crew help. If they are not breathing or you can't feel a pulse, begin chest compressions immediately at a rate of about 100–120 compressions per minute and depth of roughly 5–6 centimeters for adults. Ask for the AED and have someone fetch it while you compress.
A few practical details that matter in a cramped cabin. Move the person only when necessary. Moving a person with a suspected spine injury can cause harm. If you must reposition someone to clear the airway, do it carefully. Use a blanket or jacket under the head to keep the airway neutral. Take off or loosen any restrictive clothing like tight collars. If family or medical information is in their wallet, read it aloud to relay to the crew. Keep other passengers back to give space and to reduce stress for the person. Many airline crews have access to ground-based medical support. When the crew declares a medical emergency, the pilots may consult a doctor via radio or satellite, and the airline's operations center will begin assessing the need for diversion. That consultation is another reason to be precise when you describe signs. Time last seen normal, breathing status, skin color, and any visible injuries. Useful short phrases. Unresponsive, X minutes. Breathing, yes/no. Pulse, yes/no. Skin, pale/blue/sweaty. These concise reports help the crew make a faster, better decision. Many useful links can be found in the description. A midpoint practical tip. If you carry a compact first aid kit and a laminated one-page reminder of simple steps, check responsiveness, call crew, check breathing, start CPR, keep it in your carry-on. If you're unsure about starting chest compressions, remember that doing compressions is almost always better than doing nothing when someone has no pulse. Hands-only CPR can keep blood flowing until an AED or trained professional arrives. Now a transparent warning about a common travel industry trick. You may see promotional offers from private medical assistance companies or add-ons at booking claiming they cover air diversion costs or air ambulance for a modest fee. Those promises can be misleading. Many policies exclude in-flight events or require pre-authorization and still leave you responsible for local ER bills. Before buying anything at the gate, check your existing travel insurance, your health insurer, and the credit card benefits on the card you use to purchase the fare. Those often give far better emergency coverage. If an agent or pop-up pressures you to buy additional coverage, say no and ask for the policy wording in writing. Another sneaky practice. Some third-party sites bury medical assistance and priority add-ons in the checkout as pre-checked boxes. Uncheck them. Your practical refusal line. No thank you, I don't want additional medical assistance coverage. If needed, I'll use my primary insurance. Keep a screenshot or confirmation of your declination if you're pushed at checkout. If a diversion happens, cooperate with crew instructions, keep your boarding pass and ID accessible, and expect a wait. On the ground, emergency services take precedence. You may be asked to deplane into airport medical care. Keep records. Take photos of the gate display, note times, and collect a written incident report from the airline if one is available. This documentation is important if you later need to claim refunds or file complaints. A few extra do's and don'ts. Do. Stay calm, speak clearly, follow crew direction, and be the extra set of hands if asked. Do. Be honest if you're medically trained, describe your qualifications briefly, and follow the crew's lead. Don't. Move someone you suspect has a neck or spine injury unless their airway is blocked. Don't give any medications you're not authorized to give. Don't let fear of liability stop you from assisting. Good Samaritan protections apply in many places, and the legal risk for helping in an emergency is generally low compared with not helping. If you're the one who helped and the airline asks for a written statement later, record what you did and when. You'll help the medical team, and your notes may be valuable to the person's family or to insurance claims. If you feel shaken afterward, that's normal. Check yourself, hydrate, and if needed, ask the crew for a quiet space or a report to the airline. In short, notice, call, check, and act. Keep it simple. Shout and tap, call the crew, verify breathing, and either place the person in recovery position or begin chest compressions and call for the AED. The crew will coordinate diversion decisions and ground medical response. If you found this helpful, please subscribe for more clear, practical travel safety tips and hit like to help others find this guidance. Thank you for staying calm and ready to help. The right action from one passenger can change an outcome.